to Seychelles now, and over 70% of the population has had at least one vaccine dose. That's one of the highest vaccination rates in the world. The rapid rollout allowed the holiday hotspot to reopen for tourists back in March. Unfortunately, since then, it's seen a spike in infections, even in vaccinated patients. So what's going on? Well, joining us now is Wavel Ramkalawan. He's the president of Seychelles, and he joins us now. Mr. President, fantastic to have you on the show. Let's talk about your incredible process or progress in vaccinating your citizens. You moved very quickly to secure doses. Talk to me about where you are now in terms of fully vaccinated people. What percent?
Well, thank you very much, Julia. In terms of fully vaccinated, as far as the 2 doses are concerned, we are at 64%. But as far as the first dose is concerned, we are at 100% because we have vaccinated 70% of our population. So this is where we stand right now.
And you're using a combination of Sinopharm from China and the AstraZeneca dose or vaccine produced by the Serum Institute of India.
That's right. We started off with Sinopharm for those between 18 and 60, and for the over 60s, we administered AstraZeneca first. But after we had vaccinated the over 60s, we also offered AstraZeneca to everyone above 18, and this combination has worked extremely well for us.
And then you opened up to tourism, as I mentioned in the introduction. Clearly, tourism is an important part of your economy. It employs around 1/3 of your workers, I believe, too. Talk to me about the reopening and how concerned we should be perhaps about seeing more COVID cases.
Well, the reopening was on the 25th of March. And since then, it's been a real success. The economy has taken off once again. We've had many visitors, but of course not from Europe, which is usually our main market. We've had secondary markets like Russia, Israel, and the UAE. These have been our main, this is where our main visitors have come from. But I must say, things were going extremely well until around the 8th of May, we saw a spike in the number of cases. And this, of course, posed, got many people asking questions, even the WHO. But I must say that the numbers have gone down. And for example, I can tell you the curve is way down. And yesterday, we only registered 58 new cases. So things have gone down. But what we also realized was that the majority of people who were contracting the virus had not been vaccinated. And those who had been vaccinated were what we call asymptomatic positives. So people were tested positive, but they didn't have any symptoms. But something else that has really struck us, and in fact, it's proved to us that the 2 vaccines have really been effective, is up to now, we haven't had a single death of anyone who's had the 2 doses. And furthermore, we had an old people's home where 86 patients who had received only 1 dose of the AstraZeneca were totally asymptomatic, and they have all recovered. So the vaccine has really saved the Seychelles.
And you raised some very important points here, I think, outside of what you're seeing in Seychelles versus those that are being vaccinated or not vaccinated around the world. Is there any reason, and some have questioned the efficacy of the Chinese vaccine, based on what you're seeing, is there any reason to assume that the assumed efficacy rate of the Chinese vaccine is significantly lower than other vaccines out there?
No. Julia, I took the AstraZeneca. No, sorry. I took the Sinopharm. In fact, I was the first person in the Seychelles to receive the Sinopharm and the first African leader to also receive the Sinopharm. I would say it's just vaccine politics. It's the West versus China and the usual politics. The efficacy of the Sinopharm vaccine is perfect. As I say, it has saved the Seychelles. If the Sinopharm vaccine was not effective, then we would, of course, have had deaths. We would have had more people being hospitalized and suffering. But this has not been the case. After I took the Sinopharm vaccine, I also did an antibody test after the second dose and 2 weeks later, and my antibodies were very high, and up to now, I haven't contracted any virus. So I would say all vaccines are working. And furthermore, yes, we've found the South African variant, but our people are doing extremely well. And there's so I have no reason to doubt the efficacy of the Sinopharm vaccine and also the AstraZeneca vaccine.
President Ramkalawan, because you've been so positive about the Chinese vaccine in particular, I will have to ask you, you did pay for those vaccine doses and there were no special privileges given by China in order for the Seychelles to get access to those vaccines.
Well, in fact, it was not China that donated the vaccines to Seychelles. We got the vaccines from the UAE. This was part of the friendship. The UAE donated the first batch of vaccines and then later on offered us some more vaccines. And even the AstraZeneca, this was a gift from India. And now we are also using Sputnik 5, and this is a gift from Russia. We've only had gifts so far. We haven't had to buy a single vaccine. So it's not what you're thinking. And,
just checking.
And
diplomacy works, sir. Talk to me.
Yes. In fact, we've been very lucky because Seychelles. So when I visited the UAE in December, I talked about the vaccine because the UAE had already rolled out the Sinopharm vaccine, and that's when we got the vaccine. And this allowed us in early January to roll out our own program.
And it's good to hear. Let me just ask you about economic recovery and how your people are doing, and also what the message is to tourists, those that perhaps have read about spiking cases. We discussed it earlier. You're saying they're coming down now. What precautions are in place for tourists that want to take a holiday, want to come to Seychelles? Are they going to be safe?
Well, I can say to everyone, I can look at anyone in the eye and say, come to Seychelles. Seychelles is totally safe. And how do I prove that? Up to now, we haven't had one case, not even one case, of a tourist having to be hospitalized. And should they contract the virus, or as we know, sometimes people come with the virus, we have the facilities. Our health system is not overwhelmed like in many countries. And this is, again, because we are taking the necessary precautions. We ask tourists to take, to wear their masks, to keep the social distancing. Even at the hotels, we have special standard operating procedures. So it is safe. And this is why tourists who come to Seychelles, and they've been coming in drones. And this has helped the country to recover. The major hotels are 90%, have a 90% occupancy rate. So the Israeli tourists have come to Seychelles and they've been able to do their PCR test, the exit PCR test. And so Seychelles is absolutely safe. And in fact, I smile sometimes when I hear Seychelles being mentioned in the news, because nobody talks about the Maldives, which is on average getting about 1,500 cases a day. So Seychelles is safe. All the taxis, transportation, and everywhere, the hotels, they've been certified by the health authorities. You can
I've got
come,
it.
enjoy your holiday, and you will go back home safe. So, Julia, take the next plane, come to Seychelles, and enjoy the warmth of our welcome.
That's a date. I have to say I was mesmerised by the pictures. They look absolutely beautiful, and I wish you all well. And congratulations with the rollout of the vaccine. That's incredible work.
Thank
So
you.
thank you so much, the President of the Seychelles there.